Let's discuss the bladder channel primary pathway. The external pathway of the bladder primary channel begins at the inner canthus of the eye at bladder 1. This point is reached by a branch that separates from the small intestine primary channel at small intestine 18. Hand-foot pairing of the second great circuit, yang axis tayang. The external pathway ascends to the forehead where there intersects with Du-24 and GB15, continues to the vertex and there connects with Du-mai at Du-20. At Du-20, two branches separates from the primary channel. One branch travels to the temporal region and intersects the gallbladder primary channel at GB8, GB7, GB9, GB10, GB11, and GB12. The other branch penetrates deeper into the brain and re-emerges at Du-17, or according to some authors, at bladder 8. From Du-20, the external pathways run to bladder 8, and bladder 9 passes Du-17 and continues to bladder 10 in the occipital region. Here, the external pathway of the channel separates into two branches. The medial branch runs to Du-14 below the spinal process of C7 where it meets the other young primary channels, then continues to Du-13. From T1, it runs parallel to the posterior midline, 1.5 lateral to it. At the level of L2, it enters the abdomen and reaches its paired sum organ, the kidney, containing two organ, the bladder. The external branch runs through the gluteal region and the thigh to the popliteal fossa, bladder 40, where it reunites with the lateral external branch. The lateral branch runs from bladder 10 to bladder 41 at the level of T2, from where it descends down back 3 tune lateral to the midline to the level of the fourth sacral foramen. From there, it traverses the gluteal region to GB30, continues along the posterolateral aspect of the thigh, and meets the medial external branch at the popliteal fossa. From the popliteal fossa, bladder 40, the channel descends along the posterolateral aspect of the foreleg to the foot, passes the lateral malleolus, travels along the lateral border of the foot to the lateral corner of the little toenail to bladder 67. From here, a branch travels to kidney 1 located on the exteriorly paired kidney primary channel, yin-yang pairing of the second great circuit. Clinical importance, exterior signs and symptoms, chills and fever, headache, occipital stiffness, pain in the lumbar region, obstruction of the nasal passages, eye pain with tearing, pain along the posterior aspect of the hip, knee and foreleg, foot pain, interior or sunk organ signs and symptoms, pain and tension in the lower abdomen, retention of urine, enuresis, psycho-emotional disorders, opistotonus. Connections and meeting point of the bladder primary channel. The connections with other channels, kidney primary channel, connections, foot yin-yang pairing of the second great circuit, location bladder 67 to kidney 1 on the foot, circulation circadian according to the organ clock, importance, exterior-interior relationship. Small intestine primary channel, connection paired according to the 6-channel theory, hand-foot pairing, tai-yang. Yang axis of the second great circuit, location SI18 to bladder 1 on the head. Circulation circadian according to the organ clock, importance above-below relationship. Connections with other organ system, kidney, bladder. The bladder channel starts at the inner canthus of the eye. It ascends to the forehead and joins the governing vessel, the Du-mai at the point Du-20. From here, a branch goes to the temple. From the vertex, the channel enters the brain to re-emerge at the nape of the neck. From here, it flows down the occiput and all the way down the back. From the lumbar area, it enters the kidney and bladder. Another branch from the occiput runs down the back along the medial aspect of the scapula, down the back to the gluteus and the popliteal fossa. Here it meets the previous branch and runs along the posterior aspect of the leg to end at the lateral aspect of the feet toe, where it links with the kidney channel. Overview of bladder points. Affect back of leg, anus, back, bladder, neck, head, brain. Treat backache. Affect the eye, expel exterior wind, extinguish interior wind, affects all internal organs through the back, transporting points. Thank you for your attention.
Let's discuss the points of the eye system. Stomach 1, Changqiang, container of tears. Stomach 1 is located when the eyes are looking straight forward, directly below the center of the pupil between the eyeball and the infraorbital ridge. How to find stomach 1? With the patient looking straight ahead, the first 4 points of the stomach channel are located on a vertical line drawn through the center of the pupil. Within the area of the lower eyelid, the infraorbital ridge presents itself as a distinct bony structure. Stomach 1 is located on the pupil line directly superior to the infraorbital ridge. Needling. Ask the patient to look upward. Gently push the eyeball upwards and insert the needle vertically along the orbital ridge in a dorsal direction. Caution. Venous plexus and arteries. Avoid injuring the eyeball and periosteum. Needling recommended only by experienced practitioners. Pay attention to needling pain. No needle manipulation. After removing the needle, press firmly on the insertion site for about 1 minute to prevent hematoma. Inform the patient that it may still be possible for a hematoma to develop. Moxibustion is contraindicated. Points for disorders of the eyes with less risk of complications include bladder 2, TB21, GB1, stomach 2, XHN5 or Taiyang, and XHN4 Yuyang. Actions or indications of stomach 1: expels wind and heat, clears and benefits the eyes. Special features: meeting point with the Yang Chao Mai and REN1, also with the 2 Mai according to some authors, important point for the eyes, entry point. Stomach 1 is good for all eye problems from heat and from exterior and interior wind. Expels wind from the face for facial paralysis, stick of eyelids. This point is used mostly for eye problems and has a very wide range of indications such as acute and chronic conjunctivitis, myopia, astigmatism, squint, color blindness, night blindness, glaucoma, atrophy of the optic nerve, cataract, keratitis, and retinitis. As it expels wind, both interior and exterior, it is used for eye problems deriving from the exterior wind heat, such as swelling, pain, and lacrimation, and paralysis of the eyelid, as well as those deriving from interior wind, such as stick of the eyelid. The stomach is the sea of liquids and cereals. It is a storehouse which receives everything we ingest, whether it is food, drink, information, or atmospheres. Stomach and spleen work together more closely than any other partnership among the officials. Together, they command the movements of lowering and raising up. The stomach likes to be cool and wet. The spleen likes to be dry and warm. As the 2 earth officials, they reside in the middle jaw, in the center of the body, and are the place of transformation, the place of humanity between heaven and earth. Stomach 1 is one of the 2 principal local points of the primary channels for the treatment of eye diseases, the other being bladder 1, and is the meeting of a network of channels. The stomach primary channel meets the bladder channel at bladder 1 before descending along the infraorbital ridge to stomach 1. The stomach divergent channel connects with the eye, and the stomach sinew channel joins with the bladder sinew channel to form a muscular net around the eye. The etiology and pathology of eye disorders is complex and varied, but may be simplified into attack by exterior pathogenic wind heat or wind cold, interior disharmony, primarily flaring of liver fire, uprising of liver yang or deficiency of liver yin and blood, or a combination of both interior disharmony and exterior pathogens. Not only is stomach 1 able to dispel pathogenic factors such as wind, cold, and heat from the eye, but by strongly invigorating and stimulating the qi and blood of the local area, it is equally applicable for disorders due to any kind of interior disharmony and is therefore indicated for the fullest range of eye diseases. This includes the traditional categories of redness, swelling and pain, lacrimation, superficial visual obstruction, dimness of vision, short-sightedness, night blindness, itching of the eyes, upward staring eyes, visual dizziness, and twitching of the eyelids. In terms of modern disease categories, stomach 1 is indicated for acute and chronic conjunctivitis, myopia, glaucoma, astigmatism, color blindness, neuritis of the optic nerve, keratitis, and blepharospasm. As the name container of tears suggests, Changqi, or stomach 1, is especially important in the treatment of excessive lacrimation, which is classically subdivided into cold or hot types, in both cases complicated by exterior wind. The cold type may be due to deficiency and cold of the liver channel or exhaustion of the liver and kidneys, whilst the hot type may be due to liver channel wind heat or liver yin deficiency with heat. Stomach 1 is entry point, crossing point of stomach yang chao mai or heel vessel and renmai. This is the start of the meridian, which is concerned with receiving and digesting things, food, drink, information, feelings. This point can help a person move on in their life if they are stuck mentally or emotionally, particularly with overthinking, for eye disorders such as conjunctivitis, myopia, the early stages of cataracts, or glaucoma. Thank you, everyone, for listening.
Let's now talk about the kidney primary channel. First, we tackle the pathway. The kidney primary channel begins beneath the little toe, which is reached by a branch separating the bladder primary channel and at its endpoint at bladder 67, which is the foot yin-yang connection of the second great circuit. The kidney primary channel diagonally crosses the sole of the foot to kidney 1 and to kidney 2 below the navicular tuberosity, continues to the posterior aspect of the medial malleolus and descends to enter the heel. From here, it ascends to the medial aspect of the lower leg, intersecting with spleen 6 and continuing to ascend the posterior medial aspect of the thigh towards the perineum. In the perineal region, the primary channel divides into two branches. The first branch, the deep internal branch, which travels to Du-1 and ascends alongside the spine to connect with the pertaining Zhang organ, the kidneys, and its paired Fu organ, the bladder. Here it divides into smaller branches which connect with REN4 and REN3, and according to some authors, also with REN7. From the kidney, a branch ascends to the liver, runs to and spreads in the lung, continues to the trachea, and terminates at the root of the tongue. From the lung, an inner branch travels to the heart, where it meets the pericardium primary channel, which is the deep yin-yin connection. It then disperses in the chest and reaches REN17. Second branch is the external branch, which separates in the perineal region and runs to the lower abdomen at kidney 11. From the pubic bone, it ascends initially 0.5 Tsun lateral to the anterior midline. From the fifth intercostal space at kidney 22, 2 Tsun lateral to the midline of the infraclavicular fossa. For its clinical importance, in exterior signs and symptoms, there will be pain in the lumbar region, counterflow, cold or weakness of the legs, dry mouth, sore throat, pain in the lateral gluteal region, and on the posterior thigh, pain on the soles of the feet. In interior or Zhang organ signs and symptoms, there will be pain, facial edema, dark rings under the eyes, shortness of breath, somnolence, restlessness, diarrhea, thin or dry stools, abdominal distension, nausea, and vomiting and impotence. Now let's discuss the connections of the kidney primary channel. First, its connection with the bladder primary channel. It is the connection of the foot yin-yang of the second great circuit. It's located between bladder 67 and kidney 1 on the foot. It follows the circadian cycle or according to the organ clock. Its importance, it is the exterior-interior relationship between the kidney and the bladder. Second connection is with the heart primary channel. This connection is paired according to the 6-channel theory of the hand-foot pairing, the Shaoyin or the yin axis of the second great circuit. Its location between the kidney and the heart on the thorax. A branch of the internal pathway of the liver primary channel travels from the kidney to the liver, penetrates the diaphragm, and spreads in the lung. From the lung, a branch runs to the heart, there connecting with the heart primary channel. Its circulation, it follows a non-circadian or not according to the organ clock. For its importance, this connection shows the above and below relationship. Next connection is between the kidney and the pericardium. It is the deep yin-yin connection. It is located between the kidney and the pericardium. A branch of the internal pathway of the kidney primary channel travels from the kidneys to the liver, penetrates the diaphragm, and spreads in the lung. From the lung, an internal branch courses to the heart, where it joins the pericardium primary channel, which is the deep yin-yin connection, and also reaches REN17. For its circulation, this also follows the circadian cycle, which is according to the organ clock. For its importance, the pericardium primary channel receives nutritive qi or the yin qi from the kidney primary channel and in the first circulation of the yin qi. Next is its connection with other Zhang organ systems. It has connections with the kidney organ, the bladder, the liver, the lung, and the pericardium and the heart. An overview of the kidney points and its functions. The primary channel affects the inner aspect of the leg, the genitals, the urinary system, the abdomen, the chest, and the throat. It also affects the uterus and menstruation. It has important points to tonify the original qi or yuan qi and essence. It also strengthens the kidneys receiving of qi, which is indicated for chronic asthma, and it strengthens the lower back. So as a review, the main channel pathway of the kidney channel starts under the 5th toe and runs to the sole of the foot at kidney 1. Running under the navicular bone and behind the medial malleolus, it ascends to the medial side of the leg up to the inner aspect of the thigh. It then goes towards the sacrum at Du-1, ascends along the lumbar spine and enters the kidney and urinary bladder. It then goes forward to enter the liver, passes through the diaphragm, and enters the lung. From here, it ascends to the throat and terminates at the root of the tongue. From the lung, a branch joins the heart and flows to the chest to connect with the pericardium channel. Thank you for your attention.
Let's discuss the pericardium channel. Primary pathway. The pericardium primary channel begins in the center of the thorax on the level of REN17, where an internal branch of the kidney primary channel ends. Having also connected with the liver, lung, and heart, deep yin-yin connection. The pericardium primary channel then divides into 2 branches. The first branch penetrates the diaphragm, descends to the abdomen, and connects with the upper, middle, and lower burner. A further internal branch also originates in the thoracic region, continues to the breast, and emerges approximately 1 tune lateral to the nipple in the fourth intercostal space at P1. Beneath P1, an internal branch of the liver primary channel emerges from the liver and joins the pericardium primary channel yin axis of the third great circuit, Jiao-yin. The external pathway ascends to the axilla, follows the medial aspect of the upper arm between the lung and heart primary channels, passes the elbow, and continues along the forearm between the tendons of the palmaris longus and flexor carpi ulnaris muscles, ending at the tip of the middle finger. Another internal branch originates in the center of the palm at P8, runs along the ring finger, and connects at its tip with the triple burner primary channel and yin-yang connection of the third circuit. Clinical importance: exterior signs and symptoms: occipital stiffness, leg cramps, red complexion, eye pain, swelling in the subaxillary region, hypertonic musculature with limited range of motion of the arm and elbow, heat sensations in the palms. Interior or Sang-Fu organ signs and symptoms: delirious speech, confusion, irritability, fullness and distension in the thorax and lateral costal region, aphasia, palpitations. Connections of the pericardium primary channel, the connections with other channels, triple burner primary channel, connection hand yin yang pairing of the third great circuit, location T8, TB1 on the hand, circulation circadian according to the organ clock. Importance: exterior-interior relationship. Liver primary channel, connection 6-channel pairing of the third great circuit, yin axis, Jiao-yin. Location: liver, pericardium. An internal branch of the liver primary channel emerges at the liver, penetrates the diaphragm, and connects with the pericardium primary channel beneath P1. Circulation non-circadian, not according to the organ clock. Importance: above-below relationship. Kidney primary channel, connections deep yin connection. Location: from kidney to pericardium and the thorax. A branch of the internal pathway of the kidney primary channel travels from the kidney to the liver, penetrates the diaphragm, and spreads in the lung. Then from the lung, an internal branch runs to the heart, where it joins the pericardium primary channel, deep yin-yin connection, and further reaches REN 17. Circulation circadian according to the organ clock. Importance: the pericardium primary channel receives nutritive qi, the yin qi, from the kidney primary channel, first circulation of the yin qi. Connections with the Sang-Fu organ system. Pericardium, triple burner. Overview of pericardium points. It pulls blood, clears heat, and cool blood at nutritive qi and blood level in late stages of the fibrin diseases. Triple burner channel is for defensive qi and qi levels. Open the minds orifices in connection with uterus and affects the chest. The pericardium channel originates from the chest and enters the pericardium. It then descends through the diaphragm to the abdomen to communicate with the upper, middle, and lower burner. A branch from the center of the chest emerges laterally from the nipple to run along the superficial channel to the axilla and down the medial aspect of the arm to end at the medial side of the middle finger. A branch from P8, Lao Gung, links with the triple burner channel at the point TB1, Gao Chong, Guan Chong. Thank you for your attention.
Let's discuss the small intestine Luo-Connecting vessel system. The pathway: the small intestine Luo-Connecting vessel separates from the small intestine primary channel at its Luo-Connecting point, SI7. It forms a three-dimensional reticular network dividing into multiple branches and sub-branches within the surrounding tissue. Horizontal divisions run to the interiorly-exteriorly paired heart primary channel, according to some schools of thought. They travel as a transverse SI Luo-connecting vessel to the Yuan source point, heart 7. A longitudinal division runs to the medial condyle of the humerus, ascends to the shoulder to LI15. According to some schools of thought, the vessel spreads and terminates here, while according to other schools, it traverses the acromion, continues to ST12 in the supraclavicular fossa, penetrating the thorax in order to connect with the heart. Clinical importance of knowing the Luo channel of the small intestine. Excess conditions will manifest as weak and unstable joints, weakness and paralysis of the elbow and the arm. Deficiency will manifest as warts. After separating from the primary, so this is just a recap, at SI7, this connects with the heart channel at heart 7. Another branch continues up the arm, crosses the elbow, and joins with the shoulder. The small intestine channel of Han Taiyang is ascribed to fire and is interiorly-exteriorly coupled with the heart channel and paired with the bladder channel of Fu Taiyang, according to six-channel theory. As far as the SI channel pathways are concerned, it is worth noting that the primary and divergent channels connect with the heart. The primary and sinew channels travel to the posterior aspect of the shoulder, while the Luo-connecting channel connects with LI15. The divergent and sinew channels connect with the axilla, the primary channel connects with the scapula, and the sinew channel surrounds the scapula. The primary and sinew channels connect with the neck, cheek, outer canthus, and ear. The primary channel also connects with the inner canthus. The sinew channel connects with the mastoid process, the teeth, and the corner of the forehead. It is by virtue of the small intestine status as a fire channel, its links with the heart and bladder channels, and the pathways of its primary and secondary channels that many of the actions and indications of the points of the SI channel can be explained. This can be summarized as clearing heat from the pathways of the channel and reducing fever, especially malarial fever. Points stomach SI1 to SI4. Assisting in transforming phlegm and clearing heat from the heart zang, especially in the treatment of mania disorder, SI3, SI5, SI7, and SI8. Cooling heat and fire and alleviating pain along the course of the channel in the arm, axilla, shoulder, scapula, neck, including mumps, and throat, jaw, mouth, teeth, tongue, nose, cheek, eyes, and ears. Points of the SI channel are particularly indicated for swelling, mainly of the neck, throat, and cheek. Treating disorders of the breast, SI1, SI2, and SI11, and lateral costal region, SI1, SI4, SI5, and SI11. The meeting of the SI primary channel with the center of the chest at REN17 can in part explain the action of these points on the breast, but there is no obvious reason why points of the SI channel should influence the lateral costal region. Note that even though the principal function of the SI-Fu is to receive, transform, and separate fluids, the only indications relating to this function are dark and hesitant urination, SI2 and SI3. Even more notably, despite the fact that the channel connects with the diaphragm and stomach, passes through REN12 and REN13, and descends to the SI, no points of the SI channel are indicated for disorders of the digestive system. Thank you for your attention.
Now let's discuss the gallbladder primary channel. First, we trace its pathway. The gallbladder primary channel begins at gallbladder 1 at the outer canthus of the eye. This point is reached by a small branch which separates from the triple burner primary channel at triple burner 23 on the frontozygomatic suture, but according to some authors, at triple burner 22, which is a handful great circuit or the yang axis of Shaoyang. From GB1, the external pathway runs to GB2 in front of the ear. Then it ascends to the forehead and stomach 8. Then it traverses to the temporal region in a slight curve, passing to GB4 to GB7 and continues to triple burner 22, anterior to the root of the ear. Then it passes through triple burner 20, superior to the apex of the ear, and curves posterior to the ear from GB8 to GB12. It then traverses the lateral aspect of the head to GB13 and GB14 on the forehead. Again, it traverses to the side of the head to GB20, then crosses the superior aspect of the shoulder and passes GB21 and triple burner 15 to reach Du-14, where it meets the other young primary channels. It then continues to SI12, but according to some authors, previously passing bladder 11 and stomach 12 in the supraclavicular fossa. One branch runs from GB20 to triple burner 17, enters the ear and travels to SI19, passes stomach 7 and continues to GB1 at the lateral canthus of the eye, descends to stomach 5, again ascends to the infraorbital region where it meets a triple burner primary channel, then descends to stomach 6 on the lower jaw, traverses the lateral aspect of the neck, passing stomach 9 at the sternocleidomastoid and meets the main branch again at stomach 12 in the supraclavicular fossa, where the latter divides into two branches. The first branch is the inner branch, which enters the thorax, meets the pericardium primary channel at pericardium 1, runs across the diaphragm, connects with the liver and the gallbladder, traverses the hypochondrium and continues to the lower abdomen, enters the lumbar region near the femoral artery, according to Salinas and others, via stomach 30 and continues along the pubic hairline of the hip. The second branch, the outer branch, descends superficially from the supraclavicular fossa, crosses the mid-axillary line and continues along the lateral thoracic wall, passing liver 13 at the free end of the 11th rib and continuing to the hip to GB29. It then traverses the sacral region, passing bladder 31 to bladder 32 to bladder 33 and bladder 34 over the sacral foramina and continues to Du-1. From here, it travels laterally to GB30, where it reconnects with the main branch. The external pathway descends along the lateral aspect of the thigh to the knee and further along the anterior posterior border of the fibula, passing the anterior aspect of the lateral malleolus and ending at the ulnar corner of the nail of the fourth toe. A further branch originates at GB41 on the dorsum of the foot and travels between the first and second metatarsal bones to the tip of the big toe and liver 1, where it joins the liver channel. For its clinical importance, in exterior signs and symptoms, this will manifest with alternating fevers and chills, headaches, eye pain, pain in the cheek and on the chin, subaxillary swellings, deafness, lateral knee and leg pain. In interior or Zhangfu organ signs and symptoms, this will manifest with pain in the lateral costal region, vomiting, bitter taste in the mouth, thoracic pain. Now let's discuss the connections of the gallbladder primary channel with the other channels. First, its connection with the liver primary channel. This is the connection of the foot yin-yang pair of the third great circuit. Its location is between GB41 and liver 1 on the foot. Its circulation follows the circadian cycle, which is according to the organ clock. Importance, this is the exterior-interior relationship between the gallbladder and the liver Next connection is the triple burner primary channel. This is the connection of the hand-foot pairing of the third rate circuit or the Shaoyang on the yang axis. Its location is on triple burner 23 or 22, according to some authors, to gallbladder 1 on the head. It follows the circulation of the circadian cycle, which is according to the organ clock. Its importance, this relationship shows the above and below relationship. For other connections with other Zhangfu organ systems, it is connected with the liver and the gallbladder organ. For an overview of the gallbladder points and its functions, first, it affects the lateral side of the leg, the hypochondrium, the shoulders, neck, and head. Gallbladder points are important points, both local and distal, to treat headaches. They enter the brain. They affect the sinews. There are several important points on the eye system, and several points open the mind's orifices, and they are closely related to the yang linking vessel and the girdle vessel. As a recap, the gallbladder channel starts at the outer canthus of the eye. It ascends to the forehead and curves downwards to the region behind the ear at gallbladder 20. From here, it runs down the neck to the supraclavicular fossa. A branch from the region behind the ear enters the ear. Another branch from the outer canthus meets the triple burner channel in the infraorbital region. It then descends to the neck and the supraclavicular fossa, where it meets the main branch. From here, it descends to the chest, and passing through the diaphragm, it enters the liver and gallbladder. It then runs down to the hypochondrial region and the lateral side of the abdomen to reach the point of gallbladder 30. The main portion of the channel from the supraclavicular fossa goes to the axilla and the lateral side of the chest to the ribs and hip, where it meets the previous branch. It then descends along the lateral aspect of the thigh and leg to end at the lateral side of the fourth toe. From GB41, a branch goes to liver 1. Thank you for your attention.
Now let's talk about REN1, Hui Yin, meeting of the yin, a Sun Si Miao ghost point. REN1 is located in the center of the perineum. How to find? In women, it's midway between the anus and the posterior labial commissure. In men, midway between the anus and the scrotum. Needling vertically 0.5 to 1 Sun. Caution, contraindicated during pregnancy. Some classic texts prohibit needling this point. Particular attention should be paid to the prevention of infection. Actions, indications, clears heat, strengthens the kidneys, and drains dampness. Regulates menstruation. Special features. Meeting point with the Tu-mai and the Chong-mai. As a Sun Si Miao ghost point, REN1 is traditionally indicated for treating epilepsy and psychosis. Regulates the 2 lower orifices and genitalia and resolves dampness for difficult urination and defecation, enuresis, impotence, pain in the penis, sweating of genitals, swelling of testicles, swelling of vulva and vagina, prolapse of rectum, hemorrhoids, pain in anus, pain in urethra, itching, and pain of perineum, hernial and genitourinary disorders. REN1 promotes resuscitation for coma and consciousness from drowning, calms the mind and opens the mind's orifices for manic depression, nourishes yin. REN1 is the point where the 3 extraordinary vessels, directing, governing, and penetrating vessels, the Renmai, Dumai, and Chongmai, emerge from the interior. For this reason, it is a dynamic point with a powerful action in moving qi and blood, and also in subduing rebellious qi, as in mental problems. Some of its indications, epilepsy, manic depression, hemorrhoids, prolapse of anus, reflect a governing vessel pathology. REN1 resolves dampness in the genital area and in the urethra and anus. It can be used for vaginal discharge, pruritus vulvae, or itching of scrotum, urinary difficulty, and difficulty in defecation. As one of Sun Si Miao's ghost points, it calms the mind and opens the mind's orifices, and it can be used in manic depression. This point also nourishes yin and benefits the kidney essence. It is used for incontinence, enuresis, and nocturnal emissions deriving from yin deficiency. It is an empirical point to promote resuscitation after drowning. REN1, under its alternative name of Ghost Store, is one of the 13 ghost points of Sun Si Miao, used in the treatment of epilepsy and mania disorder. The supplement to the 1,000 ducat formulas, in fact, specified that in men, Yin Xiaofeng extra should be needled, while in women, another extra point called Yumen 2, located at the posterior labial commissure, should be needled. Both points more or less correspond to Hui Yin REN1. REN1 is entry point, general junction point, ghost point, crossing point of Renmai, Dumai, and Chongmai, master point of the whole body, first aid for near drowning. This point resuscitates and tonifies the patient, particularly if work on the other officials hasn't brought about the change you expect, rarely if ever sedated. For people who are drowning spiritually when overwhelmed by life, it calms the spirit. REN1 is like a last resort before a person gives up the ghost. It is anatomically opposite to Du-20, or 100 meetings, the meeting of all yang meridians, helpful for hemorrhoids and painful disorders of the vagina or penis, regulates menstruation, and energy block may occur here after giving birth. Because of its location, this point is commonly underused. So we use REN1 for resuscitation for both body and spirit. It is an empirical point for resuscitation after drowning, but is more often used when the person's spirit is submerged and overwhelmed. REN1 is located at the polar opposite to Du-20, where all the yang gathers with similar unifying effects on the officials. A point of resurrection when the person seems deluged by life, a specific trauma, or just worn down by the taking on of responsibilities. This point goes directly to those early but heavenly influxes in us and summons all the wisdom and strength of those influences to raise the drowning spirit. Meeting of yin roots and calms the spirit. The conservation of yin and essences in the depths provides an appropriate environment for the presence of the spirits. This point can root us into our yin, providing the quietude so necessary for the heart. This ability to study the spirit can help balance a person suffering from florid mania or epilepsy and warrants its inclusion as a ghost point. Thank you all for listening.
Let's discuss cough overview. Cough is mentioned in the Yellow Emperor's classic, in which a whole chapter is dedicated to it. The two chapters of its Chinese name, Keisao, originally referred to two different types of cough. Ke denotes a cough that makes a noise but is without phlegm. This indicates injury to the lung. Sao denotes a cough with a phlegm but does not make a noise. This indicates that the spleen is obstructed by phlegm. Therefore, this denotes a cough that is both noisy and phlegm-ridden due to injury of the lungs and spleen from phlegm. Clinical note is a cough that makes a noise but is without phlegm. So, cough with phlegm but without making a noise. Chapter 23 of the simple question relates different sounds to different organs, and it says disease of qi manifests in the lungs with cough. Chapter 38 of the simple question, which is entirely dedicated to cough, says that coughing does not depend only on the lungs, but may be caused by each of the 5 yin organs. Lung cough is accompanied by breathlessness and spitting of blood, heart cough by pain in the heart region and a feeling of an obstruction in the throat, liver cough by hypochondrial fullness and pain, kidney cough by backache, spleen cough by right hypochondrial pain. It then goes on to say that when cough is prolonged, it may transmit from the yin organ to their related yang organs. When the cough of the 5 yin organ persists for a long time, it will be transmitted to the 6 yang organs. If a spleen cough persists for a long time, it will transmit to the stomach, causing vomiting on coughing. If a liver cough persists for a long time, it will transmit to the gallbladder, causing coughing of bile. If a lung cough persists for a long time, it will transmit to the large intestine, causing bowel incontinence and coughing. If a heart cough persists for a long time, it will transmit to the small intestine, causing flatulence and coughing. If a kidney cough persists for a long time, it will transmit to the bladder, causing incontinence of urine and coughing. Any chronic cough will affect the triple burner, causing cough with abdominal fullness and no desire to eat or drink. The same chapter clearly attributes cough to a combination of invasion of external pathogenic factor and improper diet. The skin is in relation with the lungs. When an external pathogenic factor, when cold, invades the skin, it progresses to the lungs. When cold food and drink enters the stomach, they go upward to the lungs via the lung channel, which starts in the middle burner and gives rise to cold in the lungs. The combination of exterior and interior cold causes cough in the lungs. The chapter on cough ends by giving indications for treatment. For cough of the yin organ, needle the back transporting points. For cough of the yang organ, needle the C points. For cough with edema, needle the river Jing points. The complete book of Jing Yue distinguishes between cough caused by invasion of the external pathogenic factor and cough due to an internal disharmony. Thank you for your attention.